Thank you. I'm very grateful to be here. We've heard a lot about oral health literacy of the public and this concept of public health literacy. But the one thing that I've been thinking a lot about over the last 18 years is medical provider oral health literacy. And, I think we have a sense of that we don't have enough training of providers, but we've started this center, the Center for Integration of Primary Care and Oral Health, to really dig into that. And over the last year, 2 years, we've spent trying to do a series of surveys. And so I just want to shoot a couple of numbers out because I think what we're hearing here is some of the best programs in the country. And we're forgetting that there's so many places where this isn't happening. So this past year in the journal Family Medicine, we compared 2012 to 2017. And for the first time, we saw the hours of oral health training in family medicine going down. We saw the same thing in pediatrics in the Journal of Dental Education. Only a third of residents received greater than 3 hours of oral health education. Only 50% felt their residents were ready to answer questions on their board exams in oral health, and only a quarter of the pediatric directors responded that they felt satisfied with their graduating residents' oral health competency. So still devastating numbers, despite the fact that we've been at this for quite a long time now. And I think one of the things that happened was in 2006, the Accreditation Council for Graduate Medical Education created this recommendations and even accreditation standards that oral health had to be in the pediatric and family medicine programs. And then in 2015, they took it out. And we're already seeing the numbers starting to come down around oral health training. So I know we're going to get to this later today, but we really have to look at those kind of standards. What we did see in these surveys, and I guess I'm starting with this so that we have a sense of where we are, a bird's eye view of this, is that for family medicine and pediatrics, the training of fluoride varnish is going like this. It's going straight up. And why? We have the U.S. task force recommendation that has to be done, and we have reimbursement. So I think we're going to have to come back to that concept of what is driving education, if some is going down and some is going up. And then I think the other thing is our center is trying to look at all primary care, and so we're looking at physician assistants, nurse practitioners, midwives, obstetricians, etc. What we found, Anita Glicken, in her aspect of our study, in the Journal of Physician Assistant Education that's about to come out, is that 96% of physician assistant programs are offering oral health teaching, and a third of them are providing more than 10 hours of training. In nurse practitioners, in the Journal of the American Association of Nurse Practitioners this past year, 100% of pediatric nurse practitioner programs are teaching oral health. So we've got physician assistants and nurse practitioners going like this, and we've got family medicine and pediatrics starting to go like this. And, think about where is the funding? If you look at the DentaQuest Foundation, they are putting money into nurse practitioners and physician assistants over the last couple of years, which is great. The NIOH has focused on that as well. If you look at the leadership across the country of nurse practitioners, physician assistants, all their organizations think oral health is important. I hate to say it, but my own academy is not taking it serious enough, and so we're just not getting enough effort on that. So I wanted to paint that picture of who's going up, who's going down, and some of the factors that are contributing as we get into where should the research go.